Let's talk about the process of the reconstruction of a patient once they come into your practice with Poland's syndrome from the beginning to the end.
It's at least 2 stages because when they come in, I need to evaluate their chest. A lot of the times the rib framework is also not the same as the other side. There could be rib anomalies. So everybody presents with a different architecture to their chest. A lot of the times the axillary hair is pulled down, the skin is different, it's tighter, there's less fatty tissue in fact, the skin is thinner, and the nipple is tiny and higher. And there's also what's called athelia sometimes, and I've had one patient that did not have a nipple at all. Had a bit of a tuft of hair there and not a nipple. So from far away it looked like a nipple, but in fact there was no impression of a nipple.
So then you would reconstruct that while you're in doing the...
So that's done in a second stage. So the first time they come, getting to know them, their lifestyle, and going through the physical exam, their health history. So after the consult, there's another visit when I create the moulage, which is a mold, a patty-like. In the old days we did, 10 years ago we did plaster cast. Now we have this silly patty-like product that you shape it and then it hardens on the chest. So there's an room for error because I'm doing it with my own hands and I'm trying to sculpting it to match their opposite side. I have them flat, upright, and adjust the sides, the center area, the lower part. So it's a lot of sculpture actually. The only place in plastic surgery where actually my hands are sculpting a product, which is very exciting.
You have to be an artist to do that for sure.
And there's a correction factor because I'm doing it on their skin. So we have to correct mentally, right, because it's actually sitting on their rib cage. So if the patient is fatty, there's a different correction in my head that I use than if somebody's really thin. A lot of patients are thin, but I've had somebody who was heavy also. So there's a lot of art and sculpting. That's the first stage. That's really creating the mold is the most important. It's not surgical at all, in fact, that visit. So that gets sent to a company in California who creates the actual mold. It's a semi-solid silicone, and there are different called durometers, how soft, and we have the patient and me would decide which is best for them. There's softer silicone, less soft, and firm, etc. So they'll create it based on my moulage and the durometer that we've decided, and it takes about 3-4 weeks, and they'll send it sterile packed, and so the next stage is the surgery. So they're under general anesthesia, and the incision I like to hide in the axilla so it's not seen. I've had patients who've had it here previously. I have to revise them for whatever reason, so they sought my services. I've never had to put it from a cut on their skin of the chest. So even if it's far, I have long instruments, fiber optic. It takes more challenge because sometimes the ribs have a lot of curvature. So I get it inserted in nicely, and so it's just in the axilla, and there's a drain. We give them a vest to maintain everything in place afterwards, and that is the procedure.